Good afternoon, everyone. This is Saro Arakinis, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medications news, updates, and education. So, as I mentioned in my previous video, Tenecteplase has been approved by FDA for acute ischemic stroke. Finally, it's another medication within last 30 years besides Alteplase that has been approved by FDA finally for stroke patients, acute ischemic stroke from Genentech Pharmaceuticals. And in this video, I want to share some more information about Tenecteplase, what it is, and how it works. So TNKs or Tenecteplase is a tissue plasminogen activator, clot dissolving thrombolytic medicine. TNKs is administered as a single 5-second intravenous bolus, and it starts a biochemical reaction that can break down fibrin, a component of the blood clots. The most frequent adverse reactions associated with tenecteplase are bleeding and hypersensitivity. TNKs is now indicated for the treatment of acute ischemic stroke in adults, as I mentioned. This is just a couple of weeks old news. The dosage and administration section of the label recommends initiating treatment as soon as possible and within 3 hours after the onset of stroke symptoms. TNKs is also indicated to reduce the risk of death associated with acute ST elevation MI or STEMI. The dosage and administration section of the label recommends initiating treatment as soon as possible after the onset of the MI symptoms. Alteplase and Tenecteplase are marketed and supplied by Genentech in the United States and Canada under the brands Activase and Tenecteplase, and by Boehringer Ingelheim in all other countries except the United States and Canada and Japan under the brand name Actilis or Metalis. Tenecteplase therapy should not be used in any patients with active internal bleeding, brain or spinal surgery, or a serious head injury within 2 months, a condition that increases your risk of bleeding more than the normal situation, severe uncontrolled high blood pressure, the following conditions due to an active increased risk of bleeding in like brain tumors or abnormal connection between the veins and arteries in the brain or spinal cord. Additional contraindications for the treatment of acute ischemic stroke includes active brain bleeding, and the treatment of STEMI, they include a history of the brain bleed and a history of ischemic stroke within 3 months. As far as bleeding goes, tenecteplase therapy may cause internal bleeding, including bleeding in the brain. And bleeding can also happen from parts of the body where needles have been injected or part of the body that has had recent surgery. Blood thinners may increase the risk of bleeding if taken before, during, or after tenecteplase therapy. So again, this is more information about detailed information about Tenecteplase or TNKs, a product of Genentech, tissue plasminogen activator, dissolving clots as a thrombolytic medicine. It's administered as a single 5-second intravenous bolus, and it starts biochemical reaction right away to break down the fibrin. As I mentioned, it's recommended to be given as soon as possible or within 3 hours after the onset of stroke. It's indicated to reduce the risk of death associated with the ST elevation MI and now stroke based on the new FDA approval. Alteplase and Tenecteplase are marketed in all over the country and United States and the world. And it's supplied by Genentech in the United States, Canada under the brand's name Activase and Tenecteplase, and by Boehringer Ingelheim in other countries except in the United States, Japan, and Canada under the brand name of Actilis and Metalis, as I mentioned. And it's before giving the medications such as Tenecteplase, you should be watching out for high blood pressure, uncontrolled blood pressure, bleeding risk, patients taking bleeding medications that may cause bleeding recently. So there are contraindications to Tenecteplase that you should be watching for or asking about before administering Tenecteplase. For more detailed information on Tenecteplase, make sure to comment on the video with your questions, and I'll be happy to answer any questions you may have. You can also refer to the other video I have about the Tenecteplase approval by FDA recently for acute ischemic stroke, and I'll be happy to go over more information if you need on this medication. Just make sure you comment on the video with your questions, and I'll be happy to answer any questions. Hope you enjoyed this video. As always, stay safe and take your medications.